Let's discuss interviewing the pain part 3. Why we ask? We need to ask about pain because the character, location, and timing of pain give a clear indication of the full or empty character of the condition, and they also clearly indicates various pathogenic factors such as G stagnation, blood stasis, dampness, etc. Obviously, another reason for asking about pain is that it is very common complaint and often the one that leads our patient to seek help. When we ask, obviously, we need to ask about pain in great detail when this is the chief complaint. However, even if the patient comes to us for a condition that does not involve pain, such as asthma, we should also ask whether the patient experiences pain in any part of the body. On the other hand, this may be uncover a condition that the patient did not report spontaneously, and on the other hand, an analysis of the character, location, and timing of pain may help confirm the original diagnosis. Indeed, in some cases, analysis of the pain may also add a new dimension to our original diagnosis. For example, a woman may present with the chief complaint of a mental depression, which we diagnose as being caused by liver cheese stagnation. Before concluding the interrogation, we should ask whether she experiences any pain in any part of the body. If the patient tells us that she suffers from abdominal pain and distension, this would clearly confirm the diagnosis of liver cheese stagnation. To carry the example further, if she also suffers from severe periods of pain with dark clotted menstrual blood, this clearly tells us that there is not only liver cheese stagnation, but also liver blood stasis. Since the liver blood stasis is shown purely by menstrual pain, example, the tongue is not purple, we would not have known about it if we had not asked about pain. How we ask. When we ask about pain, we should ask systematically about the following 4 aspects: location, nature, timing, response to pressure, and temperature. Location of pain. The first obvious question is about the location of pain. It is important in this respect not to accept automatically the patient's description of the location of pain. Patients often have their own way of describing a certain location, a common one being stomach when they mean lower abdomen. When the pain is in the abdomen, it is particularly important to establish exactly where it is by asking the patient to point to its location. It is even more important in children whose terminology is obviously limited and who often refer tummy ache. In channel problems, it is also important to inquire exactly about the location of pain in order to identify the channel or channels involved. For example, if a patient complains of a shoulder pain, we should inquire clearly whether the pain is in the front, the lung channel, the center, the large intestine channel, or the back of the shoulder, small intestine channel. However, in channel problems, the identification of the exact location of the pain must be done also with the help of palpation. Thank you for your attention.